Good morning, dear students. Today we're going to deal with prevention of dental trauma, mouth guards, and sport dentistry. Contents would be introduction, etiology, and prevalence of traumatic injuries, levels of prevention of traumatic injuries, sports-related or facial injuries, and sports dentistry. Appliance to prevent dental injuries, conclusion, followed by reference. What is injury? To the dental tissue. Injuries are part of the game, but sometimes we can avoid them by just practicing our techniques. Risks of injuries and sports-minded society have to be very careful with injuries. Dental trauma is considered to be a public health problem due to its high prevalence. 13 to 39% of all trauma are sports related and all accidents reporting 11 to 13% are maxillofacial injuries. Greater percentage of Indian urban schools show inadequate levels of awareness regarding orofacial injuries and their emergency care. Knowledge of prospective device is very minimal. Majority of the children are aware of mouth guards, but their use is nil. Oral predisposing factors, environmental factors, and behavioral factors will be there. In behavioral factors, unintentional and intentional traumatic injuries will be there. What is a sport to carry away from work? Sports dentistry. International Academy for Sports Dentistry definition is prevention and treatment of orofacial athletic injuries and related oral diseases, as well as collection and dissemination of information on dental athletic injuries and encouragement of research in prevention of such injuries. AFPD classification of sports. You all know that AFPD stands for American Academy of Pediatric Dentistry. Contact or collision boxing, field hockey, ice hockey, like soccer or cricket like things. Limited contact event, baseball, basketball, bicycling, diving, gymnastics, horseback riding, skating, volleyball, etc. Strenuous non-contact aerobic dancing, crew, fencing, running, swimming, tennis, weightlifting. Moderately strenuous badminton and table tennis. What are the prediction of sports-related injuries? Peter Jeffers' predictive index sport classification matrix is there, and sport activities can be characterized according to two dimensions, the velocity and intensity. Each dimension can be again divided into further three levels, high, moderate, and low. Contact sports, high intensity. This is how you will check high velocity, contact sports, and non-contact sports. Factors affecting sports injuries. Factor object effects on sports injury. Physical nature and force and impact of the object will play a major role in injury. Age, gender, body size, molecular state of mind, experience of the player, history of previous injury is a player factor. Type of sports activity is contact or non-contact. Motivate players to use protective equipment. Coach. Referees and umpires identify intentional injury to players. Sports administration identify high risk events and minimum injuries. Conditions of the play area, rough patches on the ground, use of protective equipment, helmet, face and mouth guard. What are the appliances to prevent dental injuries? Helmets, face masks and mouth guards can be used alone or in combination. Organized sports at amateur level that mandate the use of helmets, face masks and mouth guards during the practice and in competition including boxing, football, ice hockey and men's lacrosse. Helmets. They protect skin of scalp, ears from abrasion and laceration, bones of the skull from fracture, brain and CNS from direct concussion, cerebral hemorrhage, brain damage and paralysis. Face mask protects eyes, nose, diagoma. Prefabricated case of metal or composite that is attached to the helmet or headset, like how it is shown in the picture. Mouth guard. American Society for Testing of Materials, a resilient device or appliance placed inside the mouth to reduce mouth injuries, particularly to the teeth and surrounding structure. This is the definition given by STM. History. Originally designed in the late 19th century by London dentist Wolf Cross, made from Gattabucca, purpose to protect boxers from lip lacerations and soft tissue. What are the characteristics of mouth guards? Max protection, teeth, lips, oral mucus, and gingival cushioning, the shock from traumatic force. Retention cover all the teeth, readily adaptable to reduce dislodgement, bite resistant and tear resistant, constructed with resilient material, should be removable and taken in and out easily. The function should not encroach on the airway, interfere with breathing or speech, communicate freely, odorless and tasteless. STM requirements covers all teeth, maxillary arch in class 1 or class 2. Mandibular arch in class 3. Spread the force of the blow over all the teeth in a lunge. Their function is they spread the force by distributing the blow over all the teeth in the earth, shielding the lips and tongue and gingival from laceration, prevent violent contact of upper and lower teeth, prevent tooth fracture, providing the mandible with resilient support and physiological effects to athletes. What are the types of mouth guards? STM in designation that's like 69780 ascending order improvements. Type 1 stock mouth guards, type 2 mouth formed mouth guards, type 3 custom mouth. Stock mouth guards, popularly because of its low price and readily available in different colors and styles, made of polyurethane ethylene material, universal fit, one size for all. Fits loosely and lightly stitched. Must be held in place by biting teeth together. Uncomfortable, obstructs speech and breathing, offers least protection, so not recommended. Type 2 mouth formed mouth guards. Two varieties of mouth formed mouth guards are there. Shell lined variety, thermoplastic variety, also called as ball and bag. Shell-lined variety, freshly mixed ethyl methacrylate material into a hard shell, inserted and molded in the earth. And it offers good retention. They are hard and bulky. Then I exchanged it before every game for better results. Objection for the taste of freshly mixed ethyl methacrylate material, hence the use is declined. Thermoplastic variety boil and the largest share in today's market, placing in boiling water 130 degrees Fahrenheit, softer insert into the mouth and mold that bite for 30 seconds. Advantages: use close of it, easily retain the stop protectors, inexpensive, readily available, can be restored, resoftened and removed. The disadvantages would be bulky nature, often distorts easily, burning to soft tissue and possible damage to pulp of immature permanent teeth. Ball and bite type was the most commonly used of those who wore a mouthguard before. Only 28% continued. The discontinuation rate for each type, as of the stock 57 point, ball and bite 80.2%, and custom made 87.5%. Age was a significant factor for mouthguard. Breathing disturbance and general discomfort were significant factors in continuing mouthguard use. Among those who discontinued wearing mouthguard due to the breathing difficulties and comfort, there was higher incidence of injury. So you need to be very careful while dealing with the mouthguards. Made professionally or a dental cast of athletes are superior of all retention comfort. Stokes et al. And Chapman et al. Studies say that these mouthguards are more acceptable and comfortable to athletes. Currently, two laboratory methods are popular: vacuum forming and heat pressure laminating technique. Fabrication of custom mouthguards is done by two methods, as I said earlier: vacuum and positive pressure machines. Jaw joint position designed with upper and lower channels for the teeth and large anterior opening for breathing. Helps to keep the mandible forward, to prevent damage to the TMJ and to reduce likelihood of concussion. Partial dentate individual rims can be fabricated onto the thermoplastic. What are the anatomical design markers? Vertical dimension control system to ensure sufficient material thickness for the critical occlusion table, and three anterior breathing ports to facilitate oxygen exchange. Well suited for athletes undergoing orthodontic treatment. Now, the $1,000,000 question: how should you maintain the mouth guard? You have to instruct the parent as well as the child. Be washed with cold or lukewarm water immediately after use. Dried thoroughly and stored in perforated box. Rinse the mouthwash or mild antiseptic. Mouthguard should be inspected regularly to check fit. Warning for athletes that chewing the mouth guards will shorten its life. Life of birds till 15 years fixed dentition need to be renewed once a year. Adult in per year. The APD encourages Dentists to play an active role in educating the public in use of protective equipment for the prevention of orofacial injuries. An ASTM certified face protector be required for youth participating in baseball and softball. It's mandating the use of properly fitted mouth guards in other organizing sport. Coaches, administrators of organized sports to consult a dentist prior to initiating practices for sporting session. Dentist to prescribe, fabricate, or provide referral for mouth guard protection for patients at increased risk for orofacial. Third party payers to realize the benefit of mouth guards and furthermore to improve access to the service. Pediatric dentists to make partnership with other dentists and child health school administrators, legislators, and government support organizations to promote the broader use of mouth guards. Pediatric dental department to teach dental students the fabrication of custom fitting mouth guards. What is going prevention? Prevention by education. Education should provide for both genders equally and should target it equally at children, teenagers, and those who are around them. Aim of every dentist to discuss the risk factors lead to injury, special emphasis, severe maxillary overjet. So preventive orthodontic treatment should be initiated and completed before the age of 11. Children activities, games and sport involvement should be carefully addressed. There should be discussed with them as well as their caretakers. Basketball hoops example. Correct first aid when injury occurs like replanting, also to storing them in milk, looking for all broken tooth crown. This is a portion by examination of dental dermatology are likely to gain attention of young individuals. Not only anyone but also who care for them should be educated, avoid complicated language, instruct sheet, provide by ILDT insufficient to receive proper emergency care in the site of injury. Baseball. Face guard or a cage attached to the batting helmet. Custom made mouth guards offers good protection. See, use of mouth guards and other protective appliances in various sports activities. How you need to use the face guard or a cage or a face guard with a cage. So these are the things you need to be cautiously use and educate the parent while doing contact sports. Basketball. For this customized mouth guard is the only choice. Airflow is not affected. Boxing initially created for boxers to protect their soft tissues. All kinds of mouth guards are beneficial for boxers, both stock and custom made as well as bimaxillary forms to cover the both arches. Ice hockey, very dangerous for oral and dental injury. Face guards and mouth guards are beneficial. Horseback riding, as you know that violent horse might make the child or an adult fall down. So then they have to use facial injury. Injuries are common in this type of sports. So you have to use helmet with face protector. Rugby, soccer, everywhere you need to use face protectors along with mouth guards. Prevention of oral injuries from traffic accidents. These are very common extreme sports, tricks, jumps over obstacles, etc. More prone to head injuries, bicycle helmet provides protection against brain injuries also. Motorcycle injury, most dangerous of all accidents, mandatory use of helmets in some countries and prevention measures reduce mortality rate and oral maxillary injuries. Motor vehicle injuries. Head injuries are common in car accidents, persons collision in the car, driver vehicles affected by direct impact with the steering wheel, safety belts and airbags reduces mortality and also severity of oral and maxillofacial injury. What are the instructions to the parent to prevent dental injuries? If the child participates in the sport such as any contact sport, as the parent should be made aware that should use helmet or mouth protector. Babies will chew on almost anything. Keep them away from items that could crack their teeth. Use playground equipment that is properly designed and maintained. Soft landing surface material. Use home safety devices such as guards on windows that are located above the ground level, stair gates and guardrails. Teach your children to Look after their teeth as well as their friends' teeth when playing, not knocking their teeth with heavy objects. Do not push when playing. Stay seated on the swing and do not jump off when the swing is in motion. Use the states when getting out of the swing. What are the clinical applications of sports industry? Third practice. Awareness of nature of effects of sports-related trauma, incorporate prevention and management of such injuries into busy private practice. The entire staff should know and they should commit to preventive counseling, preventive services, and post-traumatic treatment of patients. Dentists should educate entire staff and dental assistants. In this way, the practice can prepare itself to become a trauma-ready office capable of handling diverse types of injury-related injuries. Prevention in sports dentistry. General prevention. All preventive measures should be made available to athletes. Causes and prevention of caries and periodontal disease. Commercially available sport drinks, dietary. Prevention of trauma. Elimination, substitution, and engineering with sensible removal of structure from playing ground. The replacement of rigid with tangible structures and provide of provision of barriers between playing field and spectators. General prevention, all preventive measures should be made available to athletes, causes and prevention of caries and periodontal disease, commercial available sports links. As I said earlier, the training to improve strength, fitness, administrative and rules and law, pre-participation screening, assessment of physical and mental strength, previous injury assessment of balance diet, with a personal protective. What is the role of a periodontist? Identifying the newborn group, very young special child convert counseling to the parents informed about the risk and inexpensive ways to prevent trouble. Counseling about the basic post dental trauma management regarding the diet and nutrition for proper fitness. Counseling of school teachers. Sports in charge should be counseled about the preventive strategies and post injury management. Role of orthodontics should explain the benefits of trauma, risk reduction class 2D1, overjet continuous importance of covering mandibularis with a mouth guard class. Role of oral surgeon, impacted third molar susceptible to fracture, they should be removed. And risk factors for sports injuries would be central motor control, body size, injury history, extrinsic factors, gender, intrinsic factors, and age. Finally, I would like to conclude that it is far better to prevent injuries than to have to deal with them after they occur. Anterior trauma can have lifelong consequences affecting each participant. Thank you.